On today's World Insight, Beijing loses no time to stop a spike in new coronavirus infections. The new normal? To frontline doctors with their prognosis. China takes a new digital era approach to building infrastructure. The details from a person in the know.
The first period is we'll use all resources necessary to fight against the spread of the virus.
And how's the Chinese economy weathering the pandemic storm? An investment mover and shaker with the facts.
It is a severe blow.
Here is our host, Tian Wei.
Hello and welcome to World Insight. I'm Tian Wei in Beijing. We begin with the coronavirus situation in Beijing, where more coronavirus cases have been reported. This brings the total number of infections to more than 100 over the past 5 days. The capital is carrying out extensive testing for new infections. Its daily testing capacity has reached over 90,000 samples. To curb the spread out of the city, outbound taxi and car-hailing services have all been suspended, and outbound travel is banned for high-risk people. Those who have left Beijing are asked to report to local authorities. Beijing's education authority has ordered some schools to close and are allowing students to opt for stay-at-home classes. For the issue earlier, I talked to Dr. Huachen Zhu, an associate professor from the State Key Laboratory of Emerging Infectious Diseases of the University of Hong Kong, and Dr. Alex Kim-Kam-Tan, an internist at MizMedi Women's Hospital in Seoul. Let's listen into the conversation. So let me begin by asking both of you about your latest reaction to the outbreak here in Beijing.
Okay, so we know that just recently we realized that there's a new outbreak in Beijing. That is kind of surprising because after all, in spite of the very strict disease control throughout the whole China, and also around 2 months completely clear of any local cases in Beijing. All of a sudden, we have these over 100 cases related to the Xinfadi market. That's kind of surprising. But what is not that surprising is that we know that now we live in such a global village, and actually outside China, in many countries, there's still a disease outbreak ongoing. So I think that this kind of emergence of the COVID-19 in Beijing at this specific market actually indicates that there might be some blind spots or some knowledge gap in our understanding of this virus. So that's kind of raising an alarm, and we have to cope with it appropriately.
Dr. Tan from South Korea. Now, doesn't that sound familiar? I mean, we've been hearing, testing, and then now we are back to the story. So, Dr. Tan, your reaction?
Right. So, COVID-19 is showing us just how effectively it spreads and it hides.
Yeah.
So, even if there are days when it looks like there are no new cases, there are, but they're just hidden under our radar. And so that's why we need to have this attitude that COVID-19 is endemic. In Korea, we know it is not going to go away for at least another year. And that's the way that we are approaching it. Few countries where they really do not have COVID-19, but I think for the vast majority of the population on this planet, we need to understand that COVID-19 is not going to go away, and so we do need to have a strategy in place for coping with this disease for the long run. And long run, I mean at least 12 to 16 more months from now.
Tell me more about how you are trying to contain the outbreaks at the second stage already, it seems.
Right, so the characteristic of the outbreaks are a little bit different because now they are centered in the metropolitan Seoul region. So Seoul is our capital city. It is the most populated city in our country. And then the environment of Gyeonggi province and Incheon, they all border on Seoul. And so we're talking about a population of about 20 million people in which we are seeing more and more outbreaks. We are seeing higher percentage of cases that are detected that have no epidemiological link. And that is very concerning indeed, because that indicates that there are people in the community who are spreading COVID-19 that we are not able to identify. And what we've been able to find out from previous outbreaks with the sort of the real-time tracing that's happening is that it spreads from the first source up until the seventh chain or seventh branch of the chain of transmission within 10 to 14 days. Wow. And so it's really a race against time to try to track and trace every single case so that we can get control.
You know, one of the things we have is about the testing. Of course, we know testing is extremely crucial, whether it is in China or in South Korea or anywhere. However, when I was on my way here to work, I saw already people lined up in front of the gate of the testing center. You know, they stand in space so that there will not be any transmission, just in case. But there is a percentage with which the testing will not be able to identify. I mean, the so-called false negative or false positive. And also, there's the issue of how many testing you can do within a day.
Well, we know that there is no 100% specific and sensitive test in the world. And so we're dealing with a test that we know is inherently flawed. However, it tends to be more sensitive. In other words, if anything, people are going to have false positives rather than false negatives. That's the way that PCR tests work. And so I think we have a pretty good idea that we are catching most of the cases that we are testing for. In terms of testing capacity, we have more than 600 screening centers located throughout the country, and our capacity is upwards of 20,000 tests per day that we can run. And if we do need to increase that capacity, we're ready to do that. However, I think what we need now more than ever is a more rapid diagnostic method. Right now, our PCR test takes about 6 hours to run, but it takes 24 hours for us to get the results back. Yes. If we have a worst case scenario where we have a huge outbreak in Seoul, say in our subway system or some place where it's a huge amplification event, 20,000 tests per day may not be enough, and waiting for 24 hours may be too long. And so I think we really do need to work on getting a more rapid diagnostic test available. Yes. And also, we're doing everything we can to let people know if they have a risk of exposure to get tested. We are using SNS messages and sending out messages on the radio and on the TV. But I think that's another crucial aspect is just letting the public know who is at risk, who might have been exposed, so that they can have testing. The testing can be done rapidly and it's done in a targeted fashion.
Another thing that is very important, Dr. Chen and Dr. Zhu, that is you talk about a scenario in which an outbreak could happen. As you see, the virus is spreading so fast, could happen within just a few days, and everything has to be ready within those few days. So now we are already experiencing outbreaks. So we have to do two things. One is to deal with the outbreak already we are having right now. Meanwhile, planning for even worse scenario, as both of you just mentioned. Can we do both? What does it mean to do both? What should we involve, and who should we involve in to do both? These are structural questions.
Case scenario planning is going on here in Seoul, and since we had our big outbreak in Daegu, we have a little bit of an idea of what we need to do. First of all, we need to have a national and regional network of hospitals so that bed space can be used very efficiently. If there is a critical patient, they should not be limited to one hospital or the hospital closest to where they're located. We need to be able to transport our patients very quickly to the type of acuity bed that they need. The other issue is just having the sheer number of beds available if there is a huge outbreak. Right now, there are maybe 1,000 critical care beds that we might be able to use, but we may need more, and so we are actually trying to procure more beds, considering maybe building an infectious disease hospital that's designated just for infectious diseases. And then we are going to need more isolation centers in the metropolitan region. We had a few dormitories set up near Daegu and the Gyeongsang-Bukdo province, but if we have an outbreak in Seoul that is big, we will need more isolation beds. And so we are working to get facilities ready just in case. It would be great if we didn't need them, but we do need to have the worst case scenario in our minds and prepared, because it feels imminent. The numbers that we're seeing indicate that a bigger outbreak could happen.
Yeah.
We are hoping that everyone is making the infectious disease measures, the prevention measures, habits. We're hoping that there will be a cultural change in our population so that people know that they need to wash their hands at least 10 times a day. Of course, mask wearing needs to happen anytime they're in the public, and then keeping the 2 meters distance. We're hoping that business owners and people who are leaders of organizations are making sure that their indoor spaces are ventilated and disinfected, so that we can make sure every day we are working to break small chains of transmission.
Dr. Zhu, China also is preparing. Today, I've already got the news that some of the hospitals in Beijing are already trying to go to rescue for Jitan Hospital, which is a hospital designated to deal with cases such as COVID-19. And of course, they're both in Beijing, so it's easier, but still the system has to work in that direction. And meanwhile, we all know that Xiaotangshan Hospital, which were used during SARS outbreak 17 years ago, now might be restarted in Beijing once again, just in case a worse scenario happens. Dr. Zhu, tell us more about what needs to be involved here for the worst case scenario. We need to prepare for it.
Beijing is located in the center of China, and it's our capital. So every day it has very busy transportation, business, and lot of population there. So apart from all the preparations in Beijing, but now we also see that some cases in Hebei and also Sichuan also related to this Xinbadi market. So we have to also get the other cities and regions also well prepared and realize that we might have this kind of risk. So I think that first facilities and also reagents, the testing reagents, and also the personnel that is well trained to cope with this kind of events once there's an outbreak. And also I think that after so many months of preparing or getting so alert, lots of people, they are kind of like becoming less and less alert against the COVID-19. But with this kind of flare-up in Beijing, I think that it's time for us to request that people still need to maintain our like good personal hygiene, and also try to keep the necessary physical distancing. Yeah, and all these kind of medical precautions when you handle a person with some possible infections, something like that.
Yeah,
so
you know,
I think
the fatigue issue is really a big one. We see that not only here in China, in South Korea, we see that in the United States, Canada, even New Zealand, which just celebrated the victory. So anywhere, everywhere, how to deal with the fatigue now to make sure that that cultural change is really going to happen. This is probably a most profound question we need to face right now. Dr. Tan.
I think A couple things. First of all, it's getting hot in Korea, it's getting hot in China, all around the world, the temperatures are rising, and so it's getting very hard for people to cover their face or wear masks.
Wow.
So we've developed KFAD masks, which are anti-droplet masks that are a little bit thinner, a little bit more tolerable, so people can wear them every day. In terms of cultural change, I think also we need to be a little bit realistic, because people want to have fun. People want to enjoy their lives. They can't be imprisoned in their own lives because of this disease. So we need to get creative and let people have outlets that are safe for having fun, for learning, for interacting. And that's, I think that's a huge challenge, because it's something that we've never had to do before. But people are getting creative. They're doing, for example, drive-through dance parties. They're doing, a lot of creative things, singing far away from each other but together. So I think this is part of the realistic aspect. So there's an infectious disease aspect to it, certainly, but then there's the rest of life, right? And we have to find outlets for people to enjoy their lives. Otherwise, they are just going to get tired and they're going to give up. And if the public gives up, then really it's a lost battle. We need to have everyone on board.
Exactly.
And so we need to let people know that they have, there are safe outlets for them to enjoy, and we need to let them know how to do it safely.
A final question for both of you. People talk about a new normal. We do not know when it started, but it's already starting. So what is new normal to you under the impact of COVID-19?
First, our lifestyle and some of the culture, we have probably have to change it or modify it. And then also we have to make ourselves more alert, more well educated with some medical knowledge. And also for the research part, I think nowadays lots of people, they are working very hard on how to develop new drugs, new methodology, new intervention measures. And I think that the policies also encourage people to have some rapid channel or green channel.
Okay, got it. And Dr. Tian, what is new normal to you?
New normal, I think, means having a heightened awareness of infectious disease. So I know some people, when we wake up every day, we're not just looking at the weather report, we're looking at the COVID-19 status report in our country. That's something that we do now regularly. So we know, where are the hot spots, where are the places that perhaps I should avoid. Also, personal hygiene, as was mentioned by Dr. Zhu, is, it just has to be part of our everyday habits. And then I think also just having this hybrid, now we're interviewing, by Zoom all the time now. This is the new normal, right? And I think this is also going to be going forward for workplaces, for education, doing things remotely in a non-contact manner, distance learning, doing things more online. I think that just has to be part of reality now going forward. Not just during the pandemic, but perhaps it will extend beyond the pandemic as well. And then also just an awareness of not just COVID-19, but other health threats, such as global warming or antibiotic resistance. I think people now have an awareness that these threats that scientists have been warning about, that they are real, that we really do need to take them seriously and act preemptively to prevent them from happening.